On this farm, the health of the herd comes first.
These girls are high-performance athletes. We need them happy and healthy and disease-free to be able to convert grass to milk.
Nestled in Victoria's Latrobe Valley, Stuart Griffin's family has run this dairy farm for more than a century.
There's a whole range of diseases that we're watching for. When they come into the shed, how they walk to the cow shed, how much milk they're producing. We're really watching for any changes in those cows that are out of the ordinary.
But now he and other dairy farmers across the country are preparing for an unprecedented threat.
It's quite new, it's something that we haven't seen before. It's a little bit of the alert but not alarmed.
A deadly strain of bird flu is wiping out wildlife across the world, killing tens of millions of animals from Antarctica to the Americas. The highly pathogenic strain known as H5N1 has spread to every continent on Earth, except ours.
Essentially, it's an animal virus which very rarely comes across and infects human beings.
But Australia is not completely immune. 4 months ago, different subtypes of the H7 strain of avian flu were detected on multiple poultry farms, and almost 2 million birds were euthanased. Experts say it's likely only a matter of time before the more deadly and contagious H5N1 strain reaches our shores. Until then, Australian farmers are watching the disaster unfold abroad, and a new development in the United States has sparked fresh concerns.
Tonight, a warning for dairy farmers in the Central Valley.
The U.S. Department of Agriculture is now monitoring cases of avian influenza and new species, dairy cattle.
In the US, bird flu has jumped species once again, this time to dairy cows. The first ever cases in cattle were found in Texas in March. Since then, the deadly H5N1 strain has infected 244 herds across 14 states.
It's very clear the virus came from wild birds, and so we know it was a wild bird into cattle introduction. How exactly that happened, we're not exactly sure.
So what we have here is some H1N1 plaques.
Visiting scientists from the US are unsure how the virus is spreading between herds, but they suspect it happens during the milking process.
They finish milking that cow, they're going to bring in another cow, and they will disinfect the teats to try and prevent mastitis, but they're not disinfecting all the milking equipment every single time.
For now, testing shows milk from affected cows is safe to drink, as long as it's pasteurised.
We'd have to assume that there certainly would be a risk of becoming infected by consuming raw, unpasteurized milk. The recommendation would be to only consume pasteurized milk products.
But there is a more pressing concern. In 4 cases, the virus has been transmitted from cows to dairy workers. These cases of bird flu in humans have so far been mild, and there is no evidence of the virus spreading between humans yet. But each infection raises the risk.
Every time that an animal influenza jumps across to humans, we worry that that would then lead to a human transmission and then a human pandemic. The worry is that that virus becomes adapted to human beings, like we saw with COVID, like we've seen with many, many infections in the past.
The world's top scientists met in Brisbane this week to discuss ways to ensure that doesn't happen.
Or if you were to ask yourself...
Among them was Chief Scientist at the World Health Organization, Jeremy Farrar.
More countries should be looking at their dairy populations to make sure their dairy populations are free. Controlling this infection in the animal sector is absolutely crucial in order to reduce the risk of humans getting infected.
We're really lucky in Australia to not be first. now. So we've seen what's happening in the US. We can learn from what's happened in the US.
Back in Victoria, Justin Toohey from Australian Dairy Farmers is explaining what to do if Belinda and Stuart suspect H5N1 has infected their herd.
The minute you see anything alarming around milk production levels, report that to the vet. Once we see it in the animals, if it were to come, the challenge for us is to put barriers in place to prevent it spreading.
To do that, an emergency response plan would be triggered. The affected farm would be quarantined, all animals would be tested, and no milk would leave the farm.
So it's quite catastrophic, really, for a farm if they do have a detection.
It is catastrophic.
If animals are suspected to have the virus, their test samples will end up here at the Australian Centre for Disease Preparedness in Geelong.
So when they collect the samples, they would,
Dr. Frank Wong is at the forefront of Australia's surveillance and testing program at the CSIRO.
So you can see on the map there where they were recognised bird congregation sites.
For now, their priority is testing birds, both wild and domestic.
So mainly poo samples from wild birds across each state in Australia to detect for bird flu viruses. If there is any signs of sick birds or dead and dying birds, those would be reported to the relevant authorities in each state, and those events would be then investigated.
He says at this stage, the risk of a similar outbreak in Australian dairy cattle is low.
So to date, that combination of genes has not been found anywhere outside of the US. So for that virus to be introduced to Australia, it would either need to have been carried by mechanical means or have infected wild bird carry that to make it to Australia.
The Federal Agriculture Department told 7:30 it is highly unlikely that this H5N1 strain will be introduced into the Australian dairy herd, but it's ready to respond if it does. It says the dairy industry has taken part in government-run exercises to prepare for any future outbreak, and tailored information is being provided to the sector.
It's important all countries have this animal surveillance going on, not just this year, but next year, the year after, because if we don't see something, we don't know it's there.